Welcome back. Well, October, as we know, Breast Cancer Awareness Month, but the month is about so much more than awareness. It's really about action, education, and empowerment. To tell us more, we are joined live by Dr. Elise Gates, a breast surgeon at Middlesex Health. Dr. Gates, so happy to have you here.
Thank you.
Very important conversations happen this month about our breast health. And today I want to ask you to highlight during this month, what is the biggest piece of advice you have for women out there when it comes to their breast health?
I want patients to undergo screening mammograms. That's the biggest piece of advice that I have. So if you are average risk, you're 40, we recommend annual screening mammograms.
Okay, so that's the biggest thing is the screenings, right? Now, there's been a lot of buzz around dense breasts, women who have dense breasts, and kind of what you should do if you have that type of tissue. What do you recommend for women who do have that?
It's a discussion with your provider, but for women who have dense breasts, we consider their mammograms slightly limited, and so they may want to consider supplemental imaging. And for most women, that's adding a screening ultrasound. For some women who are higher risk, we may recommend screening MRIs as well.
And of course, so you mentioned the importance of screening, and the age you mentioned is 40 when we start that, but there are differences for women maybe who have family history, things like that. So that's really important to talk to your doctor about.
Correct, yes. So for individuals who have a strong family history or are genetically predisposed to developing breast cancer, we may start earlier.
Okay, so very important to just have that open line of communication, right, with your doctor. And speaking of mammograms, AI, I mean, we've been hearing it used in all sorts of fields now, and it is used for the landscape of mammograms, correct?
Correct, yeah. And it's really changing the landscape of screening mammograms. At Middlesex Health, we're actually implementing AI technology to assist our radiologists with reading all of our patients' screening mammograms. And the significance is that it helps the radiologist better interpret the imaging. So hypothetically, they could pick up early stage cancer at an earlier state.
That is really, it's a wonderful direction we're heading in, right? It really helps so much. Now, Breast Cancer Awareness Month, what do you want people to know about the statistics out there? Should people be worried? Is that why they really need to get these screenings? Is it common here in the United States?
Breast cancer is the #1 diagnosed cancer in women, and a lot of people who don't have a family history don't think they're necessarily at risk for breast cancer, but in actuality, the majority of breast cancers that are diagnosed are in women who don't have a family history. So the biggest risk factors are being a woman, genetically being a woman, and also getting older, and so we need to keep that in the back of our mind.
Okay, yeah, very important that it's not just that family history. So I want to mention you're new to Middlesex Health, so welcome to Connecticut. You came from New Hampshire. What are you most looking forward to coming here, joining the team, and with your new role?
Oh, I'm very excited to be part of the Middlesex team. It's a very supportive environment, not just for patients, but providers as well. So it's a great fit.
Absolutely. Well, we appreciate you stopping by, telling us really important information we need to know when it comes to breast health. Of course, if you guys would like to learn more, middlesexhealth.org is a great place to start. Dr. Gates, thanks so much.
Thank you.